Come in.
Hi, how are you?
Oh, a little sick today.
Oh, hi, my name is Latia. I'm going to be the intake nurse today, taking care of you. I see you have on a jacket and a hoodie. The weather is kind of warm outside. Something's going on?
Yes, it just get kind of cold and warm. And see, right now I'm feeling a little hot already, so I'm just going to take off my jacket.
Okay, I'll take that.
A little hot.
You want to take off the hoodie as well?
No, I think I'm fine right now because I have periods of where I get cold and hot, so I'm just going to leave it on.
Okay, I'll be right back, okay?
All right.
That I observed Mr. Martinez, he was sitting in the chair, shivering. He had on a hoodie and a jacket, and it's not appropriate for the weather. It's pretty warm outside, so I did notice those abnormalities with him with the hoodie and the jacket on, and he was complaining of a sore throat and holding his throat as if he was in some type of discomfort or pain.
Come in.
Hi, I'm back.
Okay.
I'm gonna ask you a few questions, okay?
Okay.
Okay. Can you tell me your name?
I'm Joe Martinez.
Okay, and where are you from, Mr. Martinez?
I'm originally from Del Rio, but I've been living here in Houston for a couple of years now.
Okay, have you traveled outside the country anytime recently within the past 6 months or so?
No, I have not traveled out of the state.
Okay. Have you been around any other people that may have been sick or have had symptoms of any type of flu or cold or anything?
A couple of my coworkers have been ill the last couple of days, so it's just kind of been going around the office.
Okay, if you don't mind, what type of work do you do?
I do construction.
Construction work, so do you wear like clothing appropriate for the weather, like when it's cold? Do you wear the proper insulated suits and the hard hats and things like that, the mask and safety goggles? Do you wear the proper?
Yes, for the most part, it's kind of mandatory that you have to wear all this. So yes, I wear the equipment.
Okay, what brings you in? What is your reason for coming into the clinic today?
I'm having some pain in my throat, difficulty swallowing.
Okay, and how long has this been going on?
About a week now.
Okay. What other symptoms are you having?
Just some chills, fever at times. I feel feverish, like I get chill, I get cold and hot, and so just like with the jacket and stuff, I just put it back on.
And when you have the pain, about how long does it last?
I mean, it's constant. It lasts all day. It's kind of worse as the evening gets by. It gets worse, so it's kind of just lingers.
Okay, if I had you to rate the pain on a scale of 0 to 10, what would you rate your current pain right now?
I would rate it about a 9.
A 9, oh wow. Okay, and the description of the pain, can you describe the type of pain it is?
It's just like a burning pain when I swallow.
Okay, so does anything else like exacerbate the pain or alleviate it besides the swallowing?
Well, I try to do some saltwater gargles that I read online that you can do some saltwater gargles. That seems to relieve it, but it's only temporary. Then it just kind of goes back to the same.
Okay, so just with the swallowing, is that the only time you have pain, or is it just like when you're not doing anything at rest, it's still painful?
Yeah, it's still
the worst
painful.
Probably when you swallow.
Yes, yeah.
Okay, so what would you say would be like an acceptable pain goal? I know you said the pain goal is at a 9 right now, but what would you consider a tolerable, acceptable goal for you for pain?
Most about a 3.
About a 3? Okay. And does the pain in your throat or just the overall condition affect your daily routines?
Yeah, because it affects. I haven't been able to eat well. I'm trying to eat just some soups, but I love food and I haven't been able to eat well. So it's like it's affecting me eating.
Oh wow, well that's not good. So we'll take a look at that, okay?
Okay.
Hey, can you tell me a little bit about your past medical history? Have you had any surgeries?
I haven't never had any surgeries. Never been hospitalized.
Okay, have you had your flu shot this season?
I have already had my flu shot.
Okay, and are you up to date on your childhood immunization?
Yes, I am.
Okay, and do you have any health history that I need to know about? Not pertaining to the throat, just any health history, any health issues that you have?
Just hypertension.
Okay, and are you currently taking any medications to control that, or is it with diet?
No, I do diet, but I also take medications. I take losartan.
Okay. And do you have any known drug allergies food allergies or either drug allergies that you're aware of?
Azithromycin.
Azithromycin? Mm-hmm. Okay, cool. Okay, so let me go grab your chart and I'll be right back and get some more paperwork, okay?
Okay.
Okay, thank you. Mr. Martinez, and also any past medical history as well. Now I'm going to proceed on with the equipment needed to do the assessment. For him, I'm going to need an otoscope, a nasal speculum, tongue blade, gloves, and a pen light. Okay, Mr. Martinez, I want to inspect the external part of your nose. Do you have any pain or irritation on the outer part of your nose that you know of? No? Okay. So now I'm going to ask you to put your index finger over your right nostril and do this. Okay, do the same for your left. Okay, this is checking patency of both nostrils to make sure either nostril is stopped up, okay? Now I'm going to inspect your nose with the otoscope. Head back for me a little bit. Okay, everything looks normal. Your septum is midline. Nasal septum is midline. Okay, I'm going to palpate the sinuses. Any pain, tenderness?
No.
Nothing? Okay. Now I'm going to use my pen light and I'm going to check for any opacities. I'm going to put it here. I should see red. I'm going to do it here on the right side. Down. In here. Okay? So that indicates you don't have any head cold or sinus congestion there that way, okay? Now I'm going to open your mouth for me. Say ah.
Ah.
I'm going to grade your tonsils. Your right tonsil looks like a 2 and the left one is a 3. I do see some redness and irritation and also the pharyngeal wall as well as a little bit inflamed, okay? All right.
Okay.
That's it. The doctor will be in shortly, okay?
Okay.
Thank you.
I'm going to now perform a skin assessment, and we are going to teach the skin self-evaluation. The equipment that I will need is going to be the exam gown. You need adequate lighting. You need a magnifying glass, a tape measure, a handheld mirror, and a comb. Hello.
Hi, how are you?
Ms. McLean?
Mm-hmm.
My name is Joe. I'm going to be the nurse. We're going to be talking about just doing a skin evaluation and also going to talk about how you can do a skin evaluation at home to check for any abnormalities, okay?
Okay.
How often do you perform a skin self-evaluation?
Honestly, I can't remember, but I think it's probably at least every couple of months or so.
Okay. Well, studies have shown that it's very important that we evaluate our skin at least once a month. Mm-hmm. And so I'm going to talk about some points that we can kind of go over together and see if we can kind of work out a plan so that you can do a skin self-evaluation at least once a month. Okay? First, I'm just going to inspect your, do a little skin assessment, and then we'll get started, okay?
Okay, no problem.
So I'm just going to look at your skin. And just stretch out your arms for me. There you go, okay? You just have some moles, and we'll talk about the moles here in a minute. In your face right here, okay, I see that. Okay, I'm going to touch your skin here. Feels warm. Okay, and then I'm going to just palpate your head, your hair. Feels soft. Is there any tenderness or pain?
No.
Am I touching that?
No.
Okay. Alrighty, now I'm going to look at your nails. Okay, nails feel soft and spongy. You got good capillary refill, less than 3 seconds. Okay, and so now the next thing is we're just going to go over the skin assessment. So the skin assessment is done best after a shower. Okay. So you will need a long mirror that you'll place in front of, you'll stand in front of a long mirror. You're going to get out of the shower and completely disrobe yourself. And so you're going to stand facing the mirror first. And you're going to just observe your front of your body, and you're going to face backwards, and you're going to look at the back part of your body. Then, to inspect the sides, you're going to lift your arms up, and you're going to do the right side, and then you're going to turn and look at the left side. While you're standing with your arms up, you're going to bend your left elbow, and you're going to observe for any kind of abnormalities in your skin, any lesions that you see that weren't there before. You can do that on the right side as well. And then you're going to get a comb, and you need a handheld mirror, and you're going to start inspecting your neck using the mirror on the wall. You're going to start inspecting your neck, and to do your hair, you'll get a comb, and you'll just do partitions as you're looking with the mirror to see if you see any abnormalities. Okay. You'll also run the mirror down the back of your legs, just to make sure that you can catch all the areas. And then you'll also do the bottom of your feet. Very important to get the bottom of your feet so that you don't miss anything down the bottom and in between the toes as well. The last section is just your back area. You can just kind of look at the mirror standing in front of it, okay?
Okay.
All right. So, any questions on how to do the skin self-evaluation?
No, I don't think I have any questions.
Okay. Do you want to kind of go over it with me just to make sure that we hit the highlights and make sure that you're able to get how to do it?
Okay. Sure. So the first thing you said I want to do, it's best to do it after the shower, right?
Yes.
So I do it after the shower. I'll just rub myself. I'll look in the mirror on the wall, look along the mirror, see my whole body. I'll turn from front to back, turn side to side. Then I'll take a handheld mirror and I'll look at the back part of the posterior end of my body, and then my feet, and then also while I'm standing, I'll look at the front and back of my arms as well, and I'll take a comb and I'll part my hair and I'll comb through it, and I'll have the mirror looking to see if I see any lesions in my scalp. Is that correct?
Yes, that's correct.
Okay.
So do you know how an abnormal lesion or an abnormal mole would look?
No, I think I've heard of that A, B, C, D, E stuff, but I don't know exactly what it means.
Yes, so we'll kind of go over that. So the ABCD is an acronym that they came up with to kind of help us compare moles and make sure that they're not cancerous or they're not turning to be something malignant. So if you see any mole that is less than 6 millimeters or like a pencil eraser head, those are okay. But if it starts to grow larger than that, then those are the ones you want to pay attention to. Okay. So first you're going to look at your mole and you're going to determine whether it's the same size all the way around. If it's a certain... Okay, so then the next step is we're going to look for the border of the mole. So the border just means if it's a full circle or if it's got irregular borders, so if it kind of branches out into like a spider, that's another indication that it's an abnormal growth. The third one, we're going to look for color change. Is it a solid color? Is it tan, brown, black? Or if it's got some alterations in color in the middle, is it pale in the middle? The next thing is we're going to look at the diameter. Like I told you earlier, if it's bigger than a pencil eraser head, that might mean that it's, you have to monitor the growth on that, make sure it doesn't get any bigger than that. And then the last one is called evolution. It's just the changing of the mole over time. Has the mole stayed the same when you first noticed it, let's say 6 months ago, to the same or to how it is now? And so those are just some of the things that you have to look for that are abnormal. These are the things that you would report to the doctor. But if you have a flat mole that's tan, brown, black, it doesn't grow, it's circular, it doesn't itch or bleed, that those are what's considered to be normal moles. You just have to keep an eye on them when you do your skin assessment. Okay, so some of the other things that we like to encourage is to stay out of the sun between 10 and 4. That's when the UV lights of the sun are really strong at that time. But we have a mnemonic that we encourage our patients to use, and it's called slip, slop, slap, and wrap. Slip is you're going to put your slip on a shirt. Slop, you're going to slop on the sunscreen. Slap, you're going to slap on a hat. And then wrap, you're going to wear some sunglasses just to protect your skin and your eyes from the UV light of the sun. Okay, we're also going to encourage you to avoid tanning beds, because those are artificial sources of light that those are dangerous to your skin. Okay? Okay. Do you have any questions?
No, I think that's it. If I have any more questions, can I call back to the office?
Yes, you can always call back to the office. And so when are you going to do your skin self-evaluation?
I'm going to do it once a month, but I need to figure out, like, do I need to just pick a certain day that's easier? Do I put it in my calendar? What do you think will be best?
Whatever is most convenient for you, but if it helps you, whatever helps you remember is going to be the best day to pick, and just kind of stick to that. To that day. That way you can do it. Let's say you pick the first day of the month, then just that's most consistent with you. Then just keep that same day each month. Okay. Okay. All right. Thank you.